I'm Nick Altmeyer with linkinglewiscounty.com. We're here this afternoon at Lewis County Public Health with Public Health Director Ashley Waite, and Ashley's going to give us a little bit of an update on the COVID-19 virus and just some of the precautions that are being taken here in Lewis County. So currently, Ashley, there's no confirmed cases in Lewis County. I don't think there's been any testing of anyone in Lewis County.
That's correct.
Okay. But we do have, I think you worded it as less than 5 people that were placed under voluntary quarantine because of some international travel that they had experienced.
Yes, that's correct. So anybody who's currently returning from a highly infected area, so currently that's China, Japan, Italy, Iran, and South Korea, is required to be on what's called a precautionary quarantine. And these individuals sign an agreement that they will stay in their homes, confined away from the rest of the family members, and will stay there for 14 days. We check on these individuals twice a day in regard to the symptoms that they are experiencing, just to make sure that they stay healthy before they go back out into the general public.
Okay. And are you at liberty to say like how far into the quarantine period we are with these individuals?
Not specifically.
Okay. So over the last week or so, we've been getting more and more questions here about just different questions about the virus and things like that. So could you explain a little bit about, currently we have 108,000 cases worldwide with over 3,800 deaths related to the COVID-19. Here in the U.S., as of 3 p.m. this afternoon, we were showing over 600 cases with 22 deaths. And in New York State, it shows that the highest number of cases in the United States are concentrated in New York State with 142 confirmed cases. Can you talk a little bit about what areas of New York State are being impacted at the moment, and what are some of the symptoms that people experience with this virus?
So it's mostly downstate. New York City, Westchester County is our largest area of a cluster. There are some in Nassau County. A few other outlying counties have a couple of cases. The symptoms associated with the virus are much like the flu: cough, fever, and shortness of breath. So it is very easily confused with the flu. Okay.
And with the COVID-19 virus, so we have heard it referred to in a number of different ways. So originally, when the story was first breaking out of China, they were referring to it as the Wuhan coronavirus. Then we heard it called the novel coronavirus. So you did a good job of explaining to me kind of all these are talking about the same thing. And basically, because this is a new disease, a new virus, it takes a little bit to get it named or whatnot. So we've officially now have it as COVID-19.
Yeah.
So going forward, you should see things referred to as COVID-19.
COVID-19, novel coronavirus, which just means it's a new coronavirus. There's many strains of a coronavirus. So this one in particular is new to humans. It was particularly in animals before. So anytime you have a new virus, especially when there's an outbreak of that virus, you need to name that so everybody's on the same page when they're talking about it.
Okay. And then as far as why we're seeing, so some people ask, you get the question of they see how many people contract just a normal flu virus during the course of a year here in the United States, and how many deaths are associated with that. And they kind of wonder why so much attention on the COVID-19 virus. So you and I talked a little bit about when you have a brand new virus, there's a lot of different reasons for that. A lot of it is nobody has immunity to it, things along that. Did you want to talk a little bit about that?
Yeah, so like you mentioned, there's no immunity like there is with the flu virus. We've been vaccinating against the flu virus for years. This is new. We're a ways out, 12 to 18 months before we have a vaccine for this. And that's due to vaccine development and also testing. You can't just produce a vaccine and then go inoculate people. You need to test it to make sure that's safe. So it's that, it's the fact that it is new and we don't know exactly we know now, but we didn't know exactly how it was spread or how easily it was contracted. So the more cases we have, the more we're learning about it. But it does cause some alarm when it is a new virus. We know currently that about 80% of individuals that contract will resolve and go about their lives and be just fine. There's another 20% who will have more severe illness and maybe hospitalization is required. These tend to be the more elderly and people with underlying health conditions. So there's certainly cause for alarm with trying to protect these individuals, because there are people that are dying from this, and yes, it is currently less than the flu. However, this is not widespread like the flu is.
Right.
So it's hard to compare this to the flu currently.
Right. And less in all aspects, so less in actual diagnosed cases, less in deaths. But when you look at it as the mortality rate, and it changes every day, especially with a new virus, and as we see more and more cases come in, but definitely a higher mortality rate than the flu currently.
It's currently a higher mortality rate. We are expecting that to drop. So I'm sure you've heard in the news there's been limitations on testing. So we've been testing individuals who we're fairly certain have the virus, who are symptomatic, while there could be a whole other subset of the population that is not symptomatic, but we're just not testing them. We're doing more widespread testing now within the last few days. That has really opened up. We are adding new labs here in New York State to run the tests, so we have increased capacity for testing. And as we find more cases, we are expecting that mortality rate to drop.
And I think you told me that currently New York State has some of the more aggressive testing of any of the states here in the United States.
Yes.
Okay. Perfect.
Which can correlate to why you're seeing higher numbers here in New York State.
Correct. Okay, perfect. So we did talk a little bit about those who are most vulnerable, and you had mentioned people that already have an underlying condition, whether it be a heart condition, lung conditions, obviously, or those that are elderly as well. And also, I think you touched on an interesting point too, saying that 80% of the people wouldn't have severe symptoms.
Correct.
So something to keep in mind is if you do have a vulnerable member of the population in your household, that you should still take precautions, even if you might not experience the symptoms, to not expose it to your other members of your household.
Absolutely. Okay. So extra hand washing, covering your cough, wiping down frequently touched surfaces, and maybe reconsidering going to a mass gathering event where you could potentially be exposed to the coronavirus, and then bring that back to your loved one at home.
Okay. And as far as if you think you've been exposed or you're experiencing any of those symptoms that you've talked about, what should somebody do? Here specifically in Lewis County.
So if they think they've been exposed in regard to travel, we are expecting individuals who have traveled, who we don't already know about and haven't been notified by the CDC, to let us know. So we're monitoring those individuals, like I said, for the 14 days.
Okay.
However, if they've traveled here in New York State, now that we have cases here, then we may not know about them.
Or California, West Coast seems to be a pretty high impact area as well.
So communication with us, communication with their primary care doctor, calling ahead of time, saying, I traveled here, I have these symptoms. If individuals are not severely ill and they meet testing qualifications, public health is prepared to go out into the community to do testing rather than these individuals coming to the provider's office or coming to the hospital.
And exposing more people if they are.
Keeping them home is going to be the best option.
Okay. And at this point, as far as like testing and things like that, over the last few days, options have opened up a lot more. So do you feel are you comfortable in your position as a public health director that if you need to get people tested, you have that capability?
Yes,
Okay.
absolutely. Providers have the latest guidance from the state in regard to who should be tested, and there's a lot more availability for provider discretion and, local epidemiology playing into this. So if we have cases, then obviously we would look at testing more individuals.
So the biggest point to take away from that, I think, is that, if you think that you could have been exposed or experienced some of the systems, as long as you're not showing severe illness or whatever, maybe don't call for an ambulance or don't just show up at the hospital. It's much better to prevent exposing to other people, to notify you guys first, and then you guys come up with a plan where maybe you go out into their home.
Yep.
Okay.
Either the local health department or their primary care provider. Absolutely.
Okay. Perfect. As far as, do you feel like, as far as preparedness here in Lewis County, I know you guys, between you and the hospital and the emergency management department and things like that, have been working tirelessly over the last week to 10 days, really preparing the county for anything that might happen. Do you feel, as far as you guys have the resources you need and to carry out those plans?
Yep, absolutely. So this isn't something that is new to us. We prepare for disease outbreaks on an annual basis. That we run drills, we have plans, so we know what to do. And we've been preparing specifically for this for a couple of months now, knowing how it's affected China.
Right.
So we have a great collaboration with the hospital and Office for Emergency Management. The hospital is working on their plans, and they're preparing for any kind of disease or the disease outbreak if it hits here. Mm-hmm. And not only those community partners, but community partners throughout the county we're working with to make sure that each respective department or agency is ready for this.
So if we end up seeing even a small number of cases, being a small rural county and a small hospital, just having those plans in place where if people have to be hospitalized with the virus or something like that, and keeping them separate from other patients, a lot of those plans are in place. And we will be talking more with the hospital on the subject of their preparedness, and we have an interview scheduled with them for later on in the week. So we'll be bringing you more on that. But as far from a public health perspective, basically it's just about, and these are good suggestions, whether there's a COVID-19 outbreak or not, just keeping people washing your hands regularly, things like that. So I think we've learned in the last couple of days a little bit more about how the COVID-19 is transmitted. So we're talking like direct contact with people, and we're talking like droplets. So I think we've read recently that like it really doesn't live on a surface for very long. Is that?
It's not fully known. That way of contracting the infection is less likely. They haven't seen as much of that, but that is still a precaution that we're taking, and disinfecting certain items is absolutely recommended.
Okay.
High touch surfaces.
Door handles.
Yes,
things like that.
absolutely. But it's primarily spread through direct contact with somebody, so being within 6 feet of an infected individual, and air droplets. So the droplets remain in the air, so in the room of an infected person.
Okay. And so basically right now, and I think you touched on this earlier, that most of the people that are getting tested are assumed to have the virus or were exposed to the virus. Do you see a point anytime in the future, nearby future, where maybe more just random tests would be going on just to kind of see what it looks like in the community?
I don't, at this point, see testing of individuals who are asymptomatic going on, but certainly if we were to get a case more testing would occur of just symptomatic individuals, not necessarily having travel history or knowing of an exposure.
Okay. And anybody that does feel like they've been exposed and maybe have self-quarantined themselves to see if they produce any symptoms or anything like that, you're saying it's important for them to reach out to public health and notify you guys as well?
Yes, absolutely.
Okay.
So that we can work with them to see if they meet the quarantine guidelines. And if not, it's always a good practice if you're sick to stay home.
Right.
Yes.
Okay, perfect. And if anybody has any direct questions or anything like that for public health, is there some way they can reach out to public health? Is there somewhere that, I know you guys, we've been in good contact with you. I think we talked about if we actually end up seeing cases in the county, we might move to like a daily or weekly briefing of, just what's going on. At this point though, for people just curious of what's going on, where can they get the most updated information from Lewis County Public Health?
So, number one, they can call our office. We've been taking many phone calls from the public and community partners and answering their questions. Number two, we've been putting information out on our Facebook page and trying to ease fears and provide good information. We also have information on our website, on the county website, for those frequently asked questions. We direct people to the CDC website for the latest information, as well as the state's website. This is a rapidly evolving situation, so it's important that we provide the most up-to-date information.
Yeah, it changes on a minute-by-minute basis for sure.
Yes.
Okay, Ashley, well, we realize that you've been very busy and have put a lot of time into this and the preparedness for this, so hopefully it is just preparedness and we don't need to see the full plan go into action, but we know that you guys are here prepared and ready to go if it does come up. So appreciate your time today, and as always, we'll keep you informed as new developments come up.